Hi everyone! Today I want to talk to you about dental implants. I know that they're getting very popular. You probably see them advertised out there, different price ranges. There's also a lot of confusion on them. I often see patients that think that it's the same as a root canal post. So let's go ahead and explain to you a little better on what dental implants are, okay? First thing is that dental implants can be used to replace either one or multiple missing teeth. Also, people that wear dentures use dental implants to just get a better stability and retention of their dentures. They don't have to worry about having an embarrassing moment where their denture will just pop out, have we seen in a lot of funny videos out there. But anyways, we'll talk about that in a different video. So basically what a dental implant is a dental post that can be made either of zirconia or ceramic or titanium. I know a lot of people don't want any metal now in their mouths, so know that you have the option to go metal free. Just know that there's just more studies and there's years and years of titanium dental implants. So let's go ahead and explain to you a little better on how the procedure works. So let's imagine that you were missing this front tooth right here. So you would get your dental implant and it would go inside your gums and your bone. And then we have to give it some time to heal. We call it osseointegration. And what this is just the healing of the bone. It's forming around the implant, making sure that that implant stays stable and has enough support for our future crown. So this healing process ranges anywhere from 3 to 6 months. It depends on the area of the mouth we're working on. It depends on the quality and quantity of your bone. And also, well, we know everybody has a different organism, right? Everybody heals differently, but that's just the range, anywhere from 3 to 6 months. Then once that healing process is done, we go in and then we place this abutment that's gonna serve as a connector from your implant post and your future crown. So then we take impressions, we send them to the lab, and then they give us our beautiful crown back, and we put it back there, and voila, you have your beautiful smile back. I know it seems pretty easy. Some people get afraid of the thought of getting a screw inside their gums. Yes, it might sound weird, but know that typically people have very mild pain. You can have a little bit of swelling and maybe a little bit of bruising, right? But for the most part, people just tell us that they've had a more painful experience with a tooth extraction than with a dental implant. Now, I haven't had a dental implant, so I'm not sure about that now, but that's what studies say, that's what patients say, and that's what we look at when people come in for their checkups, right? So now, as easy as it might look, know that not everyone is a candidate for dental implants. Unfortunately, there's certain medications that you might be taking that can be a contraindication for that. So we have to make sure to know that you are a candidate for this. We take a look at your medical history, medications you take, and of course, we take a look in the mouth. There's a whole list of things that we have to look into, and several x-rays, EBCTs. That way we are sure that you qualify for this treatment. Right now we are doing complimentary evaluations. So let us know if you are interested in coming and see if this is a treatment for you. If dental implants is not a treatment for you, we always have a different option. So the important thing is to replace that missing tooth. Don't go toothless there. Let me know if you have any questions and I'll be happy to answer them. Thank you.